Start. Namaste once again to the third day of our webinar. Today's two sessions, we will be having Dr. Pawan Kumar Singh coming on first, and then Swami Mitrananda. Dr. Pawan Kumar Singh is the Joint Advisor to the National Disaster Management Authority of India, and Dr. Singh joins us from New Delhi, and he is going to tell us about how the government has the robust machinery to take care of these kind of events, and beyond normal the run-of-the-mill disasters like floods and earthquakes and so on, how this kind of pandemic is a unique kind of natural disaster and how the government is handling this disaster. So we are all eager to listen to Dr. Pawan Kumar Singh. Sir, thank you very much for making it to our webinar, and the floor is yours now, sir.
Thank you, Surendranath ji. Namaskar everyone, welcome. And first of all, let me thank Mr. Nike and his NGO for inviting me for this webinar. And I will be sharing the steps which have been taken by the government, both at the national level and at the state level, and how they have been engaged into this control of this pandemic from last, if we say, because it was the first case, as we know, was reported in way back in January 31st in China. And since then, how this has progressed and how the government of India and the state governments have taken lead to control the pandemic. So what I have done is I have made a small presentation for this purpose, and the presentation is basically divided into two parts. The first part is about the disaster management structure in India, how it functions, because you must have heard about disaster management during this pandemic, and many things emanate from the disaster management perspective. And the second part focuses on the various actions or the steps which have been taken by the central government and the state governments. And also, I would like to briefly focus on the various solutions which are available for particularly for such situations, and which relates to the economic perspectives also. So I have divided it into two parts, and the first part will be about the structure. So we would begin with the first part. I will share my screen, and so is my screen visible? Mr. Surendranath? Okay. So the first part, as I told you, is the disaster management in India and how it operates, how it functions. So if we just go a little bit into the last 10-20 years, there have been a massive change in the style of functioning or the nature of responsibility, ownership, how we are collectively doing as a country. So until 2001, if you may recall, there was a very massive earthquake in Bhuj in Gujarat in 2001, and till then the responsibility of disaster management was with the Ministry of Agriculture, because till that time only floods and droughts were there. And then the scenario changed, and then we had a massive earthquake in 2001. Then we had a very furious tsunami in 2004, Boxing Day tsunami in December 26, 2004, which hit a major part of Tamil Nadu also. So after this earthquake, the responsibility through a cabinet note was transferred to Ministry of Home Affairs in June 2002. And subsequently, the government of India kept a very vigilant approach, and then the authority, the National Disaster Management Authority, was constituted with an executive order in May 2005. And the Disaster Management Act inter alia was passed in December 2005. So this act basically promulgates a three-tiered governance in India, which is the NDMA at the apex level. Then we have state disaster management authorities at the state level, and then we have the district disaster management authorities at the district level. And all ministries of the Union of India and all state governments have a role in reducing disaster risk. So this background, basically 5-7 slides, is very much required to understand the nature of pandemic and also how the government of India machinery is working. So when we talk about the Disaster Management Act, that basically enshrines, or act basically proposes to move from a response and relief centric approach to a paradigm shift more holistic approach which covers the prevention, the mitigation, the preparedness, rehabilitation, recovery, and reconstruction. So these are the 6 facets of disaster management. The first 3 are the pre-disaster cycle, prevention, preparedness, and mitigation, and the last 3 are the rehabilitation, reconstruction, recovery, are the post-disaster cycle. So this acts also provide for establishment of legal and institutional framework at 3 levels that I have already told, and then it provides for formulation of policy and plan backed by statutory and financial support. So we have funding mechanism at the national and state level, and we also provides for the legal mechanism for backing this the activities or the actions which are taken. Then it also provides for mainstreaming of multi-sectoral disaster management concerns into the developmental process, the daily developmental process of schooling, of hospitals, of that is education, hospitals, and then for PWD and other things, how to inculcate disaster management into the basic developmental framework of the state and how it can be used, because so as to avoid the disasters which will be coming in the future. And then it also has a mitigative part, how to mitigate those disasters. Like many of the disasters are unforeseen, like this COVID. So how to mitigate them, that is also part of the act. Then the structure also provides for the NDMA, which is at the national level, in which the Prime Minister is the chairperson. And then it also talks about a National Executive Committee. This committee is to assist the disaster management structure or to assist the National Disaster Management Authority at the apex level. Committee comprises the Union Home Secretary as the chair and secretaries of 14 ministries and Chief of Integrated Defence Staff as its members. So this is very important, because if you have seen the orders of lockdown, the Union Home Secretary, not inter alia as Secretary Ministry of Home Affairs, but as Chairperson National Executive Committee, has exercised his powers and has suggested for lockdown pan-India, because this act provides for the NEC to take steps for a disaster or a threatening disaster situation. So the sections both 6(2)I and 10(2)J in the Disaster Management Acts says that the NDMA will direct the NEC to take appropriate action, and the NEC therefore will go for that particular action as provided by the Act. So the 14 ministries are agriculture, atomic energy, defense, drinking water, environment, forestry, finance, that is expenditure, Department of Expenditure, health, power, RD, UD, science and technology, and water resources, and telecommunication. So if you see, basically NEC has been operating in last 3 months by 2 secretaries. So Union Home Secretary as chairperson NEC has delegated some of his powers to Secretary Ministry of Health and Family Welfare for various health related issues. So COVID has been handled as a pandemic which has been declared by WHO. So and then as a disaster by Government of India. So basically it is being handled both into medical interventions and non-medical interventions. So non-medical interventions are being looked after by MHA, and the medical interventions are being looked after by Ministry of Health and Family Welfare. So they have been functioning jointly and collaboratively in this NEC. Then there is also a concept of nodal ministries for dealing with various hazards, and also nodal agencies for early warning. Like we have for floods, we have Central Water Commission; for drought, we have Agriculture Ministry. Then for tsunamis, we have inquiries, and for cyclones, we have IMD, and also for earthquakes. So these are the nodal agencies for early warning, and then we have a concept of nodal ministries. If we talk about the national authority, the national authority mandate as per the Act is to issue policies on disaster management, guidelines for preparation of plans by ministries and departments of the states, approve the national plan. We have a national disaster management plan which came out in 2016, and then it was subsequently revised in 2019. So I will come to that later. And then approve plan prepared by the ministries or departments of Government of India, coordinate enforcement and implementation of policy and plan. Then it can recommend funds for mitigation, provide support to other countries. And this is a section which I was talking, take measures for prevention, mitigation, preparedness and capacity building for any disaster or for threatening disaster situation. And then issue policy and guidelines for the National Institute of Disaster Management. So this is a mandate of the national authority at the apex level. This is a list of the nodal ministries and departments. I will not go into detail. Only if you look at serial number 11 for biological disasters. So we have a national disaster management guidelines for management of biological disaster, which was issued in 2008, it talks about whole lot of activities which are being taken care of, like containment zones. Then we have isolations, we have quarantine, we have social distancing, we have masks and 95 masks, we have protective suits, everything it talks about. So based on that guidelines and based on the National Disaster Management Plan of 2019, the Ministry of Health and Family Welfare, as soon as the epidemic or the pandemic broke out in India, came out with the guidelines of management of such pandemic, and it came out with all possible solutions which were listed in the guidelines. So the, like I have shown you, state have to look to the guidelines and state have to look to the national plan while preparing their state disaster management plan also. So parallelly, states also came out with similar instructions based on the instructions of the Ministry of Health and Family Welfare and of the instructions of Ministry of Home Affairs. So this is a list. So this is our plan. Basically, plan talks about making India disaster resilient across all sectors, achieve sustainable and inclusive disaster risk reduction by building local capacities, and starting with poor and decreasing significantly with loss of life, livelihood, assets in different forms, including economic, physical, social, cultural, and environmental. And it also talks about enhancement of ability to cope with disasters at all levels. So it is a very comprehensive, holistic, whole of government approach type of plan, and it takes into account all the facets of disaster management and all the various precautionary and also the mitigative actions which are required to deal with such pandemics. So these are the National Disaster Management Guidelines which we have issued till now. It is around 31. So if you look at on the left side, if you look at serial number 6, it talks about the biological disaster, for which I have already told the 2 in the red one are basically under preparation. So now we will focus on, with this pretext and this background, it will be easy to understand how this scenario has unfolded, because we come across many information on social media, on the television, on the print media. So basically this clarity has to be there to understand the actions which have been taken in relation to COVID-19. So first I will focus on the actions which have been taken by the National Disaster Management Authority, and subsequently I will go towards Government of India actions, various ministries, be it Ministry of Home Affairs, Ministry of Health and Family Welfare, Ministry of Railways, Ministry of Labour and Employment, and other ministries. So to start with, NDMA, what it did was, it started the video conferencing with all the SDMAs on work to be done other than medical issues. Like I told, it is non-medical interventions related to COVID-19. It started in first week of February. So as soon as we came to know that there is going to be a pandemic, it may hit India also, and we may face serious issues. So it was started very early, and we came into action mode. And then the visits were conducted in first week of February to sensitize the chief secretaries and SDMA. I myself went to Calcutta. I myself went to Raipur, Chhattisgarh. So officers of Government of India were deputed to various states. They met the chief secretary, they sensitized the health department, they sensitized the principal secretary, revenue and disaster management, to kindly look into the issues of mask and other things, and also of PPE, sanitizers and other things, because it was sensed in the very beginning itself, in February itself, that it may turn out into a major pandemic unfolding in India. And then subsequently advisories were issued to SDMAs on 4th February and 5th of March, and also on 17th of March, before the first lockdown was ordered. So basically there was a complete sync between the Government of India and also the state government, how they are going to tackle this situation. And then it took the help of epidemiologists and assisted the concerned empowered groups before the first lockdown. So based on the directions of PMO and Niti Aayog, 10 empowered groups were constituted. The first group dealt with the management of for the preparation of emergency management health plan, and subsequently there were various empowered groups, like how the transportation will unfold, how the supply of essential items will be maintained, and how other things will be, how the economic sector will be looked into. So there are various empowered groups, and so it assisted and all the groups had epidemiologists. They were predicting scenarios, how the scenario may unfold, how many cases we get, and this was dealt in a very systematic manner. And then it participated in all the empowered groups which were constituted, like I have told. Then the coordination with civil society organization, like I was just discussing before we started with Mr. Surendranath, that there are listed around 92,000 NGOs across India, and we will be we were just looking into this, and we were just looking into this, and also I'm not able to see my screen. I will cancel this. What is this? So the NGOs were coordinated with, and they are also working on the ground, and they are very efficient on the ground, and they have been doing a lot of work. Then a template was prepared both for the state level and also for the district level planning purpose for the COVID-19. These templates were given to Ministry of Health and Family Welfare, and these templates were circulated to all the states and districts to prepare their templates, or to prepare their plans for curtailing the numbers of COVID-19 positive cases, and also for effective management. And then awareness materials including audio visuals, do's and don'ts, and frequently asked questions was prepared for all type of stakeholders, be it migrant worker, be it house people who are inside their house, or also people who are working for frontline workers, essential services, everybody. So different type of awareness generation material was prepared. And then we went for advisories to the state government for management of heat wave and concerned disasters during the time of COVID-19. Here one point I have missed. If you may recall, last month we had two major cyclones, Amphan and Nisarg. So advisories were issued to concerned state governments of Andhra Pradesh, Orissa, West Bengal, and also in case of Nisarg to Maharashtra and Gujarat. So Amphan hit on the eastern coast. So the eastern coast sites and the western coast states were, Maharashtra and Gujarat, were advised to kindly look into the capacity of the relief shelters. It should be reduced to 1/3 because social distancing has to be maintained. Then the frontline workers which are handling people or which are evacuating people, they should wear suits, they should have N95 or a general mask also. Then they should be supplied with sanitizers. All these kind of advisories were issued to the state, because this is very much clear, and I hope everybody understands that a disaster, if suppose pandemic is running, it does not ensure us that the cyclone or any other major earthquake will not come. So it has to go simultaneously. How to handle all the disasters at one time, that is a major challenge for us. Then we also got in touch with the states and also helped them in the psychosocial support counseling for over 11,000 COVID-19 patients. That was a very major achievement for the psychosocial support. For this, we got in touch with INMAS and also for Delhi-based institutions. So IEC activities were also involved generic do's and don'ts on COVID-19, specific video appeals to the masses to observe physical distancing during festivals. Then there was a wear your mask campaign. Then COVID-19 do's and don'ts for hearing impaired, and then also campaign on mental health awareness during lockdown. Abda Mitra, we have a scheme for community flood volunteers which is called Abda Mitra, and these volunteers are not only used for floods, they are also used for cyclones, they are used for other active disasters also. So how these volunteers helped the government functionary or government machinery in maintaining in managing this COVID-19 pandemic. So they were also trained through IEC material. And then we shared important guidelines, orders on Government of India on COVID-19, and wide dissemination of Ministry of Railways status on Shramik trains. That I will come later. So if we talk about COVID-19 specific interventions by NDMA, there was a major program for contact tracing and breaking transmission chains. This involved travel history mapping of patients. More than 6,000 high-risk categories persons details were shared with the states and UTs, and also 5,000 persons informed about possible exposure. So besides Arogya Setu, this was also a major line of work. And then there was also an initiation and development of National Migrant Information System, and the problem was very serious, if you remember, in the end of April or in May. So it was devised, a system was devised, a platform was devised, how the migrants are going from one place to other place. And then this was also shared with the Ministry of Railways and Ministry of Home Affairs. And like I have told, it was psychosocial support for 11,000 patients, and also mobility monitoring in 30 major cities, how the graph is moving, how the persons are moving from one place to another place, and how they can be supported and they can be quarantined and they can be brought to the normal life. So for Abda Mitra, there were states like Assam, Bihar, Kerala, Maharashtra, Orissa, Tripura, Uttarakhand, and West Bengal. In these selective districts, in close coordination with the district administration, following activities were taken. The community surveillance was taken, home delivery of essential items, logistic support in running and monitoring quarantine and isolation centers and home of suspect cases, then dissemination of awareness creation, and dissemination and awareness creation and preparation and distribution of food among the needy, and also sensitization drive at public places. So these were the activities which were taken by NDMA. And the last was interventions with the technology. I already told about the contract tracing of 6,000 persons, which was shared with the states and UTs. And we also assisted the Arogya Setu app backend approach in collaboration with IIT Madras. So a platform was developed and then it was shared with the Ministry of Health and Family Welfare. Decision support system, it is a tool in which it enables the state governments or the union territory administration to take appropriate decision based on the current situation. So this is developed basically on a GIS platform, in which it was a case profile on georeferencing, then logistics support, how it can help for DSS, and then it was for quarantine breach monitoring and risk index. So risk index is basically about the hazard, the vulnerability hazard is our pandemic, how much vulnerable I am, and also the georeferencing, like I've already told you, case profile. So based on this, a risk index was created for a particular area, like for Mumbai or for Delhi. How much is the risk index? And then with travel history of 2.31 lakh patients, how they were traveled from one place to another place. Then there was development of NMIS, and also COVID Savdhan was one app which was disseminated more than 57 crore messages on geofencing. So this was also used in addition to Arogya Setu, and mobility monitoring I have already told. So this is the part one, what we have done as NDMA, and in association with Ministry of Health and Family Welfare, Ministry of Home Affairs, and also Ministry of Railways. And now I will like to come on the basically the announcements of Government of India post COVID-19, and how Government of India is taking it as a pandemic, and how it plans to deal with such scenarios. So basically, in Pradhan Mantri Garib Kalyan package, this is a package of 1.7 lakh crores, and free. The basic idea is for free food, grains, and cash payments to women and poor senior citizens and farmers. So this comprises again of financial assistance of rupees 67,478 crores to 42 crore poor people. It contains 17,891 crores as was front loaded towards payment of first installment for PM Kisan. So basically it is a boost for the farmers of India, and it also comprises rupees 10,325 crores for 20.65 crores women. So 100% women account for Jan Dhan Yojana were taken, and they were given money in 3 installments, first, second, and third. So it is 20.65 crores, then 20.63 crores, and 20.62 crores. So the subsequent money was given in the accounts of Jan Dhan Yojana of 100% women subscribers. So this was part of the 67,000 crore. It also contains rupees 2814.5 crores to 2.81 crore old age pension, widows and disabled persons in 2 installments. So basically the national our social accreditation program or social assistance program, under which pension is given to the old, the widows and disabled persons. So that program is started in 1995. So Government of India has put money into that program, and then it to help these type of people, this type of citizens of India. Excuse me. Then it also included 1.82 crore building and construction workers receiving financial support of rupees 4,968.35 crores. So this was about the financial assistance of 67,000. Like I told you about 67,478 crores to 42 crore. I have a sheet also which summarizes this. So these were the activities financial support was given. So if you talk about the food grains, so out of 117 lakh million ton of food grains which was lifted by all the states and UTs, it was distributed into 3 parts: April, May, and June. So I have data mostly till June end, and in some cases it is on 7th or 8th of July, because after that it was not possible to get the data. So this July running right now. So the data is available at the end of the month. So when it was distributed into 3 phases, so 37.07 was in April, 36.87 was in May, and 31.18 lakh million ton was in June. So you can see the number of beneficiaries: 74, 73, and 62 crores were given this amount of food grains which was lifted by the state. Then besides food grains, 5.83 lakh million ton of pulses were dispatched to all the states and UTs. Out of this, 4.63 lakh million ton were distributed to 18.2 crore household beneficiaries. So out of this 4.63 crores lakh million tons, 28 states have distributed 100% for April. 22 states and UTs have completed 100% distribution for pulses for May, and 11 states have completed 100% for June. So this is the graph of distribution of pulses. If we talk about Atmanirbhar Bharat, it is if you focus on the stranded migrants,
Kumar ji, audio, something wrong with the audio.
June 2020. So the last point is very important. Free distribution has also been there to ensure the sustainability of the citizens. Then 24.64 lakh members of employees provident fund organization has taken benefit for withdrawal, which amounts to rupees 6,804 crores. And the increased rate has been notified. The rate of interest has been notified from 1st of April 2020. In the current financial year, 113.65 crore persons man days of work has been generated already till June 30th. And further, rupees 41,469 crores released to states to liquidate the pending dues of both wages and material. So basically, the money which is being disbursed through EPFO or through other means, the money has been given for the disbursement. Then 24% EPF contribution has been transferred to 41.16 lakh employees account amounting to rupees 1479.31 crores. So this is the sheet I was talking about. So I have already talked about Prime Minister Jan Dhan Yojana for women account holders, then support to NSAP, aged, widows, Divyang and senior citizen, then front loaded payments to PM Kisan, then support to building and other construction workers, then contribution for EPFOs and Ujjwala. So this total comes to 42.06 crores. So if we leave, this comes to 42 because we are not taking account the serial number 5. So besides serial number 5, it is 42.06 crores. And the amount is 67,478 crores, like I told in the beginning. So this is the sheet for all the financial and the kind assistance which has been given. Besides this, there is a fund called which is State Disaster Response Fund. So both, like I gave you a brief about the disaster management because more or less it is being handled in a disaster like situation. So the steps were taken to ensure protection for vulnerable groups. So MHA, what Ministry of Home Affairs did was it asked the states and UTs to set up control rooms with helplines and appoint nodal officers. Further, the MHA expanded its own control room and set up 2 new toll-free numbers to receive complaints. Besides this, Government of India allocated 11,092 crores in advance from SGRF. Basically, it is in a receipt mode, but this time it was given in advance as a special dispensation to all the states to deal with the ongoing crisis management. So right now, with the latest order, which I have not included in this, the 35% of SGRF can be used for relief camps. It can be used for buying PPE suits. It can be used for testing and other things. So 35% of money has been allocated for use of COVID-19. Then on 14th of March 2020, states allowed to use SGRF for setting up quarantine facilities, testing laboratory and equipment. This was authorized by Ministry of Home Affairs. Subsequently, on 28th of March, SGRF funds were also permitted to be used for relief camps and providing foods to homeless people, including stranded migrant workers in the country. And special measures were taken to ensure alternative livelihood, because that is very important, because many people have lost their livelihood during this COVID-19. So how it can be restored back? So measures were taken for destitute persons and their families who could not mitigate their economic condition. So as a measure of special relief for person stranded, this is for till last slide it was still for Ministry of Home Affairs. Now we are talking about Ministry of Railways. So special relief for person stranded, the Indian Railways till 6th of July operated 4611 Shramik special trains since 1st of May. So from 1st of May to 6th of July, around 4600 trains were operated by Ministry of Railways. So these Shramik special trains are operated as a train on demand purpose. When the sending state requests that I need a particular train or with so many bogies so that I can transport these many number of passengers, a list has to be given, and then accordingly a train is arranged for the sending state based on the request and convenience. And the said Shramik special trains has transported approximately 63 lakh migrants to various destinations located in Uttar Pradesh, Bihar, Jharkhand, Orissa, and Madhya Pradesh. If we talk about Ministry of Health and Family Welfare, so these were the measures taken by MHA and by Railways. And Ministry of Health and Family Welfare, besides the National Health Mission, they have also allocated fund under the National Health Mission to various state governments to take appropriate measures. They have issued guidelines for testing, for tracking, tracing, isolation, and quarantine. And the states were encouraged to use the National Health Mission funds to facilitate and accelerate the health response system in the state. Then it also advocates for expanding the use of mobile medical units for services delivery and follow-up care for reproductive, maternal, newborn, and child health services, chronic communicable and non-communicable diseases, use of telepath, telehealth, and other apps. So basically, the other type of issues, medical issues, which require urgent and immediate attention, they were advised to take care of that also in line along with the COVID. And also the states were advised to ensure that the private health facilities continue to provide critical services such as dialysis, blood transfusion, chemotherapy, and institutional delivery to their regular patient. They should not refuse the patient, and they should be treated well along with the COVID. For this, Ministry of Health, what it did was it created a single call center number 1075, and it also augmented the bed capacity of the state. It worked with the state tirelessly from March to June to increase the bed capacity from 44,505 in the first lockdown period to 13,47,000 beds till 8th of July. And 31 state UTs governments have provided cash benefit ranging from 1,000 to 6,000 per worker for the construction and the building workers, like I have told you, besides the money which have been given by the Government of India, but direct benefit transfer from the cess fund to more than 2 crore workers across the country, involving an amount of approximately 4968 crores. So this money is basically the same money, but it has been, the amount of dispensation ranges from 1,000 to 6,000 per worker for direct benefit transfer, that the money has been sent directly into their account. And states have also, certain states have also started releasing the second installment of the settlement. So if this is the scenario with which the Government of India has taken up all the measures, and I would like to share one thing before we come to the last slide. So this is the scene for today. I hope this is visible to everyone. So basically, there are as on 800 hours today morning, there are 3,73,000 active COVID cases throughout country, and 6,77,000 have been cured and discharged, and there have been 26,816 deaths. So if you talk about specifically about Tamil Nadu, so Tamil Nadu is here. I will just show you. So Tamil Nadu, it says it is 49,455 active cases, 1,13,856 cured, discharged, or mitigated, and deaths have been 2,403, with total confirmed cases of 1,65,740. So this is the scenario till 8 o'clock in the morning. And basically, this is my last slide. So if we talk specifically about Tamil Nadu, so Tamil Nadu basically in April it came out with the revised ex gratia from 10 lakh to 50 lakhs, and it recently the Chief Minister, Honorable Chief Minister, has said that there are around 600 plus medical camps will be there in Chennai. So medical camps have been increased. And also, Government of Tamil Nadu has constituted a high-level committee under the chairmanship of Mr. C. Rangarajan, who was formerly the RBI governor, and also he was member of the advisory committee to the Honorable Prime Minister. And this high-level committee has to give its report within a period of 3 months. So the committee was constituted in early May. So by early August, the committee will give its report. Basically, the committee has to see on the impact of economy, both from the economist and the industry perspective. So the committee comprises the experts from both economist and industry, and also it has to look into immediate and medium-term impact on the economy of the state. So like we have discussed, the agriculture will be hit by this COVID. Then we have industry, we have the trade, and we have also the trade associations and different type of activities. Tourism is also there. So how we can keep the pace of economy and how we can improve upon the economic parameters that this committee will suggest by early August. And also the possible source of financing and funding. So how, from where the money will come, how we can meet, because all this what I have told till now is basically how we can mitigate this COVID-19, and besides that, how the state will get up on its own feet, and also again start making economic profitable ventures and also running the economy. That is very much important. That is very much based on the fact that we have to devise a strategy how to tackle the situation and to move ahead. So this was basically the government approach, both the central and the state government. But what I was told by Mr. Nyaki, see, actually, if we talk about the various measures, so first I will talk of the various measures, how to get in touch. So there is an interministerial COVID-19 platform of the government of India at india.gov.in. You can go there, you can get in touch with the concerned persons, and you can also raise queries for various loans and various other issues. And also, if you want to start some new venture, how you can get the money, so that can be tackled there. And also the respective state governments, because the principal secretary revenue and disaster management is the nodal person for handling the COVID-19, and how you can also get in touch with him, and how to get the benefit out of and how to get the impetus money or the seed money which you require to start anything new for after this pandemic is over. And the district magistrate has also been made nodal for the district level purposes. So there are 3 levels. One is the district magistrate, the other is the nodal officer at the state. So besides that, many states, including Tamil Nadu, have appointed the nodal officers for COVID-19 management. So it is the relief commissioner and also the nodal officer at the state. And then the central level, I have told you, there is an interministerial platform in which all the information is available. There are concerned persons, and you can get in touch with them, and how you can start anything new, or how you can take benefit of all these issues. And then the solution is basically, see, the amount of efforts which have been taken by the state and central government are right now basically concentrating on the mitigative part, or on the management side. But yes, this is very important, because the economy has to run, and that is why this 1.7 lakh crore package has been announced. And also the various activities which initiate from this purpose has also been taken care. So the solutions are basically very easy. Anything which has to start after this pandemic, so that has to be based on the various schemes and programs which have been initiated by the government of India and the state government. So this was my last slide. Thank you very much.
Thank you very much, Dr. Singh. That was a very in-depth explanation of what all the disaster authority and the central government with the state governments have done. And I was just, yesterday in my street itself, there was one camp run by the Corporation of Chennai, where people from the corporation and some volunteers came, and they were sitting there and dispersing Ayurvedic medicines for prevention. And they were also going around houses. And my mother lives alone in a suburb of Chennai, and people were coming to the house. There was a volunteer who comes daily to the house to check on the status of senior citizens who are living alone. So it is really wonderful to see that even such local body interventions are not happening haphazard, but I didn't realize that it had a central planning and a central thought right at the topmost levels of our government and at the central government level for all of this. So this has been a real eye-opener, sir, in terms of how each one of the ministries and the state governments have coordinated. And I think this presentation will be a wonderful explainer, and this should be made more public, and more of the Indian public know and be able to appreciate what the government is doing for us. So thank you very much, Dr. Singh, for this excellent presentation.
Thank you.
Very grateful to you.
Thank you.